Hello, ladies and gentlemen. Welcome to Has 20 Virtual Summit Breakouts. During this session, you'll be able to submit questions and upvote questions from other attendees. The questions with the most votes will most likely be among the questions asked by the host to the presenter at the end of the session during the live Q&A. The bottom right tile box is where you can type in your question as well as click the thumbs up button to upvote a question. During the session on the top right tile box, you will also see a 5-question quiz based on the speaker's content. Enhance your learning by taking the quiz during the session and get points for your correct answers. All sessions will be available on demand, and if the presenter has given us permission, you will also be able to download the slides. It is now my pleasure to introduce Session 8. The Era of Disruption and Uncertainty Ignites New Data and Analytic Imperatives. It will be presented by Laura Kraft, Vice President, Analyst, Gartner. Enjoy the session.
I want to welcome everyone. Thank you for being here. It is indeed an honor, particularly in these unprecedented times, to have the privilege of speaking to you and being able to share a little bit of my passion around data and analytics and some thoughts about what I think the future might hold. I know many of you, and I'm missing seeing you all in person. Perhaps next year we can be together, again in the luxury of the Grand America Hotel, but this year we do it differently. We do it virtually. And I hope that during the course of the user group and the summit and over the next few days, you can feel some virtual energy from your colleagues and your peers as we go through exploring what are indeed unprecedented, disruptive, and uncertain times. For those of you who don't know me, I've spent 30+ years in the healthcare industry, primarily on the provider side, and I've always had a strong focus and passion around data and analytics. That is why I am very excited to be here at what I think is an incredibly opportunistic time for us. I imagine we're all feeling a little bit like Dorothy right now. We are not in our comfort zone anymore. And we don't know when we're going to get back there, what road to take to get back there, or even if getting back there is going to look the same as where we started. But I want to suggest that even before COVID struck and business as usual became a term of the past, quite frankly, our industry was already in the throes of tremendous transformation and change. Digital transformation is taking hold, as is evidenced by our use of real-time healthcare system capabilities, the implementation of digital twins. Our service models are changing. Digital products and services are becoming prolific within the industry. So we are in throes of transformation. In tandem with that, AI has seen rapid acceleration and is now touching almost every aspect of healthcare delivery. And then COVID struck, and it turned our industry even more upside down. And it became a powerful new influencing force as we recalibrate our strategic plans, which is what we need to do. So we have this compelling trifecta of forces, a perfect storm of disruption and opportunity between COVID, digital transformation, and AI that make it essential that we reignite our data and our analytics mission. Because at the root of each one of these topics that are dominating our conversations, our actions, and our investments across their industry, there is a foundational reliance, like never before, on data and analytics. So yes, it is an opportunistic time for us, and a truly exciting time to be in data and analytics and to be a data and analytics leader, and to be able to be at the helm as our industry recalibrates. It becomes our responsibility to make sure that this recalibration is supported by powerful and reliable data and analytic tools, insights, and capabilities. So let's dive into each of these three a little bit more, and then I'm going to wrap up with what I think is important for each of us as data and analytic leaders to be thinking about, to be executing on, and quite frankly, also to be demanding from our vendors so that we can help our enterprises move forward. Some food for thought maybe as we move through the next few days. Let's focus a little bit on digital transformation. I want to give a big sigh here. We've heard a lot about digital transformation. But what is it? It's really kind of easy to lose the forest through the trees on that because we talk about it so much. But it's important because we are becoming a real-time digital industry. So let me give you my perspective on what digital transformation is and a little bit about how data and analytics are needed to support it. The broad industry vision, which is emerging, is this digitally connected care ecosystem. I see vendors adopting this model. I see articles writing about this model, research and studies on it. Everything pointing to this direction, a digitally connected care ecosystem enabling the patient, the member, the consumer, the citizen to seamlessly flow from consumer-directed care to clinically directed and enabled care. And at the core of that, the key to making that happen is that the data and the information follows the person, the patient, the member, the consumer, regardless of how and from what point of entry they are entering that ecosystem. From a provider perspective, that vision, we talk about the hospital without walls, that our ability to participate in that ecosystem, our ability to deliver care, connect with the patients, diagnose and treat outside the brick and mortar buildings that we're used to. A great example of this is the acceleration that we saw in telemedicine and virtual care during the COVID crisis. Those solutions have been on our periphery for a really long time. But in the times of a crisis, it's amazing how quickly people adopt and systems adopt to new modes of delivery and become quite satisfied with getting care out of the traditional places that we're used to getting it. This connected care ecosystem, which we're talking about, enables the consumer empowerment that we have been talking about for years. It is event-driven, it's situationally aware, it's delivering advanced diagnostics and insights and products and services throughout that. And all of this is really enabled through a digital health framework. And I'm going to give you a little bit of orientation if you've never seen it before. It's Gartner's Digital Health Framework, and it really applies to any industry and any sector within healthcare. On the upper left is the consumer platform. We want to engage with our consumers, members, citizens, patients. We want to be able to provide them products and services, apps. We want to be able to get information from them and give them information on their care and their treatment and their protocols. All that is enabled through a consumer platform. On the upper right is the ecosystem platform. We have to be more and more conscious these days of all the partners that we need to play with, and we need to be good partners within that ecosystem as well. We expect to participate with pharma, life sciences, the community resources, payers, and other organizations. We want to get data from them. We want to share data with them. We want to be able to do business collectively back and forth. That's what the ecosystem platform enables. On the bottom right are information systems that we need to do to run our business, our ERPs, the EHRs, the CRMs from a provider perspective. And on the lower left is the IoT platform, which is becoming all that more important. And also those big data sources begin to add valuable data points for our advanced algorithms and insights. And right there in the middle is that data and analytics platform. And I like to suggest, I know this is a little cheesy, the animation, but all these dots around here should be data points that need to move fluidly, seamlessly, liquidly, if that's a word, in motion around this expanding and evolving ecosystem. And that's our challenge as healthcare providers and analytic leaders, is to figure out how do we enable this connectivity across all of these different parts. Well, all that's great stuff, I get it. But to us, I think our reality feels a little different. That hospital without walls isn't quite connected yet. Unfortunately, most of our data and analytics platforms are probably not ready to completely support this vision. And the reality we know is quite different. We suffer from lack of interoperability, fragmented processes. We have chronic data conditions all over the place, integration challenges, and security concerns. But I want to suggest that this is your challenge, and it's what you need to be thinking about over the next couple of days, and what your recalibration of your data and analytics strategy is going to look like. This is your challenge to figure out what your needs and what your gaps are in your data and analytics services so that you can help your health system evolve towards the industry vision and be a good ecosystem participant. Your digital strategy is really your data strategy. The two are so inextricably linked. And we have to elevate the alignment of our digital strategy with our data strategy. In my humble opinion, I think it's really hard to have a digital-first mindset, which is something I hear around the industry, unless we actually have a data-first mindset. So digital healthcare demands a lot of data fluidity, dexterity, and liquidity. It demands an incredible array of data services that we need to expertly position so that we can be part of that growing and that expanding ecosystem. So on to AI and automation, the second part of that trifecta, the second part of that perfect storm of opportunity. This is Gartner's most recent provider hype cycle. I don't know how many of you are familiar with Gartner's hype cycle. What we do is we track technologies on our hype cycles. Gartner produces hundreds of these. This is the provider one. They are meant to track technologies from the trigger of innovation down there, starting on the lower left-hand side, all the way to mainstream productivity on the right-hand side. Through their journey to maturity, they go up the peak of inflated expectations, down the trough of disillusionment, as they learn how to mature and become the kind of tools and technologies that we want to use. This year, as we analyze the hype cycle, what we recognized is that the vast majority of profiles on this hype cycle depend and leverage some form of AI. AI is indeed becoming truly pervasive as part of our technology foundation and our technology cores. And it is consistent with what we need to do for digital transformation. Consistent with the hype cycle, AI is being implemented across healthcare functions. We see it in research and discovery, expediting vaccine development, changing the way drug discovery and compounds are done, changing the way we conduct clinical trials. And we see it from wellness and prevention apps, the virtual health assistants that are out there, the different patient apps that we can use to help diagnose and triage what might be going wrong with us. It's used for diagnostics from, diagnostic imaging and precision medicine. These are all healthcare profiles that are becoming more and more apparent and fluid within our environment. We see it in care management, and we see it across administration and operational functions, the ability to optimize and automate a lot of the routine and repetitive tasks that are out there. And the more the sciences behind AI mature, the conversational user interfaces, sentiment analysis, voice and speech and recognition, the more these specific use cases evolve and mature for our healthcare use. Here are some examples of how they're actually being used. Predictive models are not new to healthcare. We have been using predictive models for many, many years. But the science of AI and the ability to bring in all those big, rich data sources allows us to become that much more precise in the correlations that we develop in those models. It allows us to sift out some false negatives and become much more accurate so that we can trust them much more intuitively. In the diagnostic imaging space, there's so much going on there, so much rapid development. And what I find fascinating with this one example that I give, and again, none of these are product endorsements, they're just meant to be examples. But what I find fascinating with the diabetic retinopathy example is it was one of the first FDA-regulated algorithms, diagnostic algorithms, and the FDA regulated and said, if it triggers an indication of diabetic retinopathy, you don't even need the second opinion to validate that. So indeed, we're taking work off of the radiologists that they don't need so they can focus on the harder stuff and pay attention when their time is limited and they're overworked. A lot of stuff, good stuff going on there. And then chatbots happen to be my personal favorite, and people hear me talking about them all the time. Currently, they do take numerous forms of maturity. There can be simple, rules-based chatbots for some diagnostic and triage. but some are being used for real prescriptive and next best action, really having that conversational user interface, knowing who you are, having an interface to your medical record and personal information, and actually suggesting what treatments and protocols might be necessary. So lots of evolution in that. And the other area that we really need to be paying attention to this year particularly is the notion of automation, process automation. Hyperautomation is one of Gartner's top 10 strategic technology trends, and there is huge potential for us to use it and apply it in healthcare. Dr. Eric Topol, in his book Deep Medicine, talks about automating anything that can be automated. And even before COVID struck and we are in the throes of having to figure out how to optimize our processes, how to create more efficiencies, how to really scale back with what we have suffered over the past couple of months, automation is a huge part of that recalibration. But even before COVID, I suspected that 2020, this would be one of our biggest areas of investment in AI in healthcare, because there is, again, just so much opportunity to eliminate unnecessary and repetitive tasks, to simplify decision-making, to organize, to use AI to organize and make sense of the massive amounts of data, and just to add efficiencies to workflows, whether they're clinical, operational, or administrative. So here are some statistics from a recent AI survey. The survey was done across industries, not just given to healthcare organizations, but this is the healthcare provider slice. I want to underscore that the people who responded to this survey are considered leaders in AI adoption. By Gartner's definition, that meant that they had to be either actively deploying AI or they had plans to deploy AI within the next 3 years. I'm certainly hoping that many folks in the audience are within that sense of deploying AI within the next 3 years. So this is really your peer group. And I think most of us are in that position. To me, what this survey shows when I look at this specifically, this is business receptivity to AI, is that we are getting very receptive to AI in healthcare. As a matter of fact, the skeptics and the naysayers are in the minority at this point, which is great news to me. It means to say that we've done some good evangelization around AI and that people are getting excited and learning to trust it and wanting to understand it. There is the caveat that we do want AI to be explainable. We do need AI to be able to trust it. We need to understand a little bit behind the science. So this is where we need to work. That's why I say AI is a little bit of an art and a science, is we need to be able to get that trust going, understanding what the science is behind it. But the other interesting thing that this survey showed within this group of people is that data looms as a huge implementation constraint. We know that security is going to be a problem. We know that integration is always going to be a problem within our industry. But quality problems, complexity problems, governance problems, we cannot let these be barriers to adoption. We simply have to do better. That data volume and complexity is the third biggest barrier to adoption. Says to me that we don't have our platforms, our skills, or our tools mature enough to be able to work with the vast amounts of digital data or to be executing on the AI use cases that I talked about just a few slides ago. So this is our challenge. Just like digital, AI demands a balanced blend of data art and data science, working with a lot of complex data, a lot of complex tools, and we also have to work with the literacy, the trust, the governance, and the culture. So we have a lot of work to do around making sure that our data is in the form and in the structure that we can use it successfully so we can get that trust going and that transparency going within our AI efforts and investments. Finally, we get to COVID-19. Healthcare was in the midst of transformation and disruption, as I've said, even before COVID-19 hit. And you've all lived through this battle, and I really don't need to reiterate how devastating it has been for all of us. You guys have all been on the front lines, and you've been feeling this for months. No doubt, I have no doubt there's been a lot of uncertainty within your organizations, confusion, apprehension about how do we move forward and when do we get back to our norm. But I do want to say that, the COVID-19 crisis has put a laser focus on how apparent it is that data and analytics can be powerful weapons in the fight against pandemics. I Googled just, COVID capacity planning tools, and I came up with a list on the right-hand side. That's what Google said to me. There were many vendors and organizations that immediately responded to the need and out there put tools for anybody to use to help them help organizations figure out what their volume might be, what their capacity might be, how are they going to divert patients so they can be successful in moving patients around. On the left-hand side, you see the AI epidemiologist, which was the first spotted the outbreak of the Wuhan virus. These are the kind of tools that we need to continue to have in our tool chest. Just because we might be on the waning side, if we even are, of COVID, we can't say, oh, we've gotten through this without needing it. We will need these tools on an ongoing basis. There will be an increased demand on the local, the regional, the national, the global levels to share data and participate in more collaboratives and collectives, whether or not that is understanding better biosurveillance and looking to predict and prevent a disease, or to respond and react to it in terms of who has the resources today that we need, where can we partner, where can we pool our resources from. These tools are going to be critical to have going forward. But the COVID-19 crisis also exposed serious gaps and flaws in our data nimbleness. We know where data and analytics was leveraged successfully. It really did help in our response. Where it was done poorly, our response was limited. And I have to say, even as somebody who watched the news every single night and tried to make sense of the data and the statistics that were coming out, it was a mixed bag of what the numerators and denominators were all about. Our healthcare systems were not really set up to kind of support the kind of demands that we saw. I came across this article, and it really couldn't be more true. I think I'm actually going to read it. In the United States, there were several attempts to use aggregate data from our electronic health records. It didn't perform very well at all, says Cohen, who is a chair of the Department of Biomedical Informatics at Harvard. According to Cohen, a lack of high data quality contributed to the shortfall. Exactly what our folks in that AI survey saw, problems with data quality. Most of the data that was being shared for the first 3 months was literally just case counts and death counts. To the extent there was sharing of clinical courses of treatments, protocols, anything like that, it was just from single institutions. We did not have collective intelligence, he said. And you know what? I want to posture that we still don't have that collective intelligence that's needed. And this is why we can't become complacent and think that we got by the skin of our teeth and we can just go on and forget that this ever happened. The global impact of COVID has resulted in an absolute imperative to leverage data and analytics as one of the primary offensive actions against future viral outbreaks. I am so convinced of that. And every health system, every organization, every data and analytic leader should be asking themselves, are my data and analytics positioned to be accessible, accurate, and reliable in the time of a crisis? So with that, I just want to summarize what I think all this means and what I think it means for our industry and what we need to be paying attention to. I really initially wasn't quite certain how I wanted to wrap this up. What pearls of wisdoms I might want to leave you with as you move through the rest of the user group and the summit. I think I've pretty much shared my point of view pretty strongly throughout, so just a few things to consider. I'm always looking to validate that my hunches and my point of views are actually relatively on point. After all, it's what I base my advice onto my clients on, so I hope that I get it right most of the time. And over the past few months, I've done a lot of webinars. It's a way to engage with clients virtually, and I've taken a few polls. These are the results from one of the polls that was taken in late March. And while it heartens me to see that there is an increased investment in data and analytics for 2020, this is, in data curation and enrichment services and governance, and I have to be honest, when I saw that governance response came up, had I been sitting on a chair, I would have fallen off of it. Fortunately, I was standing up, though. And I'm pleased. We finally get it right. We know that governance and data curation, this is really important. But as you'll also see from my next slide, we cannot fall behind in our dominance of AI skills, talents, and ability. We really need to beef those up so that we can embrace some of the challenges going forward. In another live poll I did, I asked, of several hundred, I asked the audience whether or not they expected their investment in data and analytics to increase, decrease, or stay the same based on COVID. And while I don't have the actual numbers, I know that it was well over 60% that said they expected their investment in data and analytics to actually increase based on COVID and the experiences that we had. And I would be so curious, I wish I was able to poll you all and see whether or not you expect to see that you will get increased funding to be able to step up to some of the challenges that we have with data so that we can use it more successfully in the future. So I really think that we need to be thinking, all of us, about what it means to us personally and our organizations to reignite our data and analytics mission so that we can meet the challenges of digital, of AI, and additional COVID-like threats. We're going to continue to need the foundations that we have been building for years. We need good pop health. That will be part of our foundation of moving to that connected care ecosystem. We need good quality in financial analytics. We need that to be able to help in our recalibration. But what I also want to suggest is that you need to work with your leadership to know what their digital strategy is. You need to help create a clear line of sight from the data strategy to the digital strategy. Do not have this alignment be a second consideration for any of your digital transformation initiatives. I mentioned this is a really opportunistic time for data and analytic leaders. This is why we can align digital with data and really make things work much more effectively. I personally think the most collective burden we have on us is to get our data right. We owe it to each other as part of this collective ecosystem to be able to be a good partner. We want to be able to share our data successfully. We want to be able to get data in from other of our ecosystem partnerships. We cannot let complexity, quality, inaccessible data impede our ability to respond and be part of this growing collective ecosystem. The data services layer is becoming one of the most critical components in the enablement of digital, real-time, AI, and the ability to respond to COVID. This is the tier of your enterprise architecture that you need to be focusing on and completely think about how that is going to be re-engineered to support digital transformation and the increased need for data and analytics. I fully expect health systems will be required to share and report out more data. An example might be, as I mentioned, participating in more regional and local collectives for resource availability. We need to be able to make sure that our resources, our data, is on a dime available for us to be able to share with people and use the way we need to. So, the COVID crisis has no doubt in my mind heightened our awareness of how we can use data and analytics. I think that, we need to be thinking about how we're going to develop our data and our analytics and our AI skills so that we can prepare for these disasters better. There are a lot of different type of predictive models that we're going to want to be thinking about. We want to think about predictive models for understanding where and when an outbreak might occur. We want to understand which patients within our community areas are the highest risk and most vulnerable so that we can reach out to them immediately and make sure that they're safe and they're protected. We want to do the same thing when somebody presents in our ED. Understand, are there really high-risk patients so that we can triage them earlier? We want to be able to understand what might be the best treatment protocol for a specific patient based on our collective knowledge of how the disease progresses and how different patients respond to different treatments. There are so many ways that we are going to want to be able to use analytics to be able to, for capacity planning and resource train and understanding how to divert patients to different places so that we don't get ourselves into the type of crisis mode that we had at the early days of COVID. For all of these reasons, we really need to think about beefing up our AI skills and talents and competencies. And finally, I think you need to press your vendors to understand how they will support you on this journey. You know, Dorothy might have made it back to the familiarity of her surroundings. They're a little dark, but they're very comfort and they're familiar to her. Our journey back is going to look very, very differently. And quite frankly, we don't want to go back to where we were. Our future holds a very, very, very different vision. We want to get to the clarity of that connected care, hospital without walls ecosystem. So press your vendors, understand how they can support you in your transformation, how they can help you mature your data and your analytics foundation. Use this user group and the summit to learn all you can about what your colleagues are doing and how they are meeting these challenges, how they are confronting the uncertainties within their health systems, and what opportunities they're putting forth on their table. I hope that you have a good experience. I thank you for listening. I hope that this sets the stage for a few good days ahead. And in the meantime, and until we see each other together next year, hopefully, please stay well, stay healthy, and stay happy. Thank you all for your time.